That you can say there is no grievous injury and simple injury is no homicidal, suicidal, accidental. I'm going to use all these terms. Are you guys aware or not aware? This is the question. But I have to. Classes to what? हमने भी बहुत classes कराई है. कुछ मतलब हमको मिलकर के आया है. I need to mention all of these things. देखो, you guys know what is abrasions, bruises, laceration, all of these. You guys know. Answer me yes or no. Two questions in class. Are you guys aware of these terms? No. देखो, depending upon the positive factor. Positive factor का मतलब क्या है? What is leading to that incidence? What is leading to that injury? Within the segregate or mechanical factors, thermal injuries, chemical injuries, and miscellaneous. Mechanical factor in reality is sort of major thing of how we are. That is a mechanical injuries. And mechanical injuries here, we have described the types of injuries that can be produced with mechanical factors. A mechanical factor where a rotor accident we have. Anything continue with a stick, with a ball, with any sharp paper, blunt paper, everything will come under mechanical factors. Okay. Another common injuries can be due to heat and electrical. Yeah, this is how. Cold. Okay. Heat, what? Burn, what? Scald. Okay. You know what is burn? You know what is burn? Scald, what? In steel, we have scald. Okay. Steel, so we get the burn injury as well. Now, due to cold, there will be either frostbite, French foot, या तो immersion. पता है ये सब क्या है? These terms, these are supposed to be taught in theory. Okay. Next, chemical injury only two types of physical injury. Either the acids or the alkalis. Okay. Now, every acid and alkali is not that much more strong corrosive sort of injury. Okay. So, क्या mention करते हैं? Corrosive acids and corrosive alkalis. Okay. Next, miscellaneous injuries, right? Self-inflicted injuries. Give me an example of self-inflicted injury. Example. क्या आता है दिमाग में? Self का मतलब क्या है? Yourself. खुद. Infliction का नहीं पता. Causing. ठीक है. Sort of. The self-inflicted injury. What do you mean? Self-inflicted injury का मतलब क्या है? Waking up, dying, waking up. Societal injuries, है ना? Hesitation marks we say. This is very important for medicine. Hesitation marks. Hesitation marks we नहीं बोलते हैं. We say hesitation marks. जब when it heals, there is a scar mark. We call it as hesitation mark. It shows that the person might have tried to kill himself or herself. Okay, these are self-inflicted injuries. Next, defense injuries. Defense injuries, we see in sort of mob incidences. Okay, or else in case of domestic violence, defense injuries come over when the person is trying to protect himself or herself from any external cause of injury. Okay, understood? Where can we find defense injuries? What are the defense stances? You try to go very good. Then it wants a border. You find it in the ulnar borders. Understood? Defense injuries can also be found here. Why? If you are trying to stop and lower it, okay, now we are defense injuries. This is important. You take care. When the patient is going to come, you can give the history. You can deduce if they are lying or not. Okay. For example, a female, 43-year-old female, she is a housewoman. Okay. She has 2 kids. Now she has come with multiple bruise injuries here. One fracture is also present in the body. Okay, in different stages of healing. So it could be that she is going through the process of what? Domestic violence. Understood? So, next, offensive injuries. What are the offensive? Offensive injuries are the same. Good. So offensive injuries we can have if when we are trying to harm the other person, we that is an action. If in the process we are harming another person, those can be the offensive injuries. मेरा पूछो, girls I can understand it. लड़कों को समझ में आ रहा है, लड़कों को समझ में आ रहा है. Why are you guys not sensitive? These people are words. Okay. Now, unintentional injuries. जो एक अगर आपको पूछ रहा हो, है ना? Unintentional injuries. Okay. Fatal and non-fatal injuries. Not before. In your excessive case, you are provided the injury report. How injury report is death of the patient. So, is a fatal injury or non-fatal injury? Fatal injury, non-fatal injury is also उसको लगा everything is fine now, you don't collapse. So, it's a non-fatal injury. Yes,
What age is
we are going to focus on primarily the mechanical injuries. Mechanical injuries can be blunt force and sharp force. Blunt force and sharp force. Force cannot be blunt and sharp, right? We are dividing this basis on the type of weapon which is causing the injury. Okay? What another is blunt? That is a blunt force. Okay? Or a blade. So, like that which blades required, chopper, all of these things, these are sharp weapons. Okay? So, if the injury is caused because of sharp weapon, we are going to say this type of injury. Sharp injuries. Okay? What is wrong with people? Now we people say, क्या हुआ आपको? किसी ने डांटा बताया आपको? एफएमबी से बहुत ज़्यादा काम नहीं किया। मुझे पता नहीं लग रहा है कि जहाँ से प्रॉब्लम है। Regular basis में break किया। Okay, fine. And you do blunt force. Blunt force. See this. Is there an injury हुआ था? It does not have any sharp end here. It's near, right? So if injury is happening, or even this one, if I hit this one on the side, there is some of the other injury that I told you. Okay. So these are the accidental injuries to have blunt force cases. Understood? Okay. Now, due to blunt force की वजह से sharp force के लिए भी same होगा. Abrasion, laceration, contusion and fracture. बताओ, कौन बताएगा? Boy, abrasion and money. Boy, what is understood by abrasion? Sit and answer. And जल्दी करो, जल्दी से बोलो। Three patient free question. Proper student scratch. What is the meaning of patient? Last time,
this means small scratch or something that causes bleeding, but it is not bleeding.
Absolutely. Tissue to थोड़ा बहुत clear होगा. Otherwise, while you see the blood flows, right? Bleach तो you can be subcutaneous level, है ना? It won't be muscle weak नहीं होगा. That is abrasion. The definition you are supposed to know. I don't know this abrasion. Yes. Now the thing is, next class आपके sharp weapons पढ़ाएंगे. So go in down to this abrasion, contusion, laceration, fracture. The definitions है. If you do not know, then you won't be able to understand कौन से level of bleeding हो रहा है skin में. Okay, these are important. इसकी basis पे आप लोगों को patients आएंगे crossing के लिए. Partially correct है. Okay, contusion. Now what is contusion? Contusion
Means impact is always
skin bleach won't be there. Continuity of the skin will be maintained. There will be no external bleeding, but there will be internal bleeding. It can be at the level of subcutaneous level, intradermal as well as deep. Deep. Head injury for in the XC case, there was some deeper water. So what does it mean? Bleeding has occurred, but it is deep. Scalpel fracture also or not. With the bleeding occur outside, no. But it is a type of contusion. If it has occurred in a very superficial level, from the outside only, if you remove the hair, you can actually see. Understood? What is contusion? So, laceration. What is the meaning of laceration? What is the meaning of laceration?
laceration in the tissue will be cut, the layers in the skin will be cut, and it can be 3 months.
Laceration. So, what is laceration? We need to understand what is laceration. Understanding is important. I will teach everything about laceration types. What? Movable. A moving irregular margins. Now, what is laceration? Split injury. What are the terms which are used to define laceration? You guys do not know definitions. Definition is the most important thing in this case. We cannot speak the words, okay? The wordings has to be correct. So, I am emphasizing this again. Answer, what is going to understand by the conversation? What? Only what is laceration? You understand what is laceration? Not necessarily. Laceration cannot be certain approaches. RTA is also RTA also have lacerations. Discontinuity of the tissue, which will lead to fresh bleeding. Okay, it can lead to erosion of the structures inside as well. Nerve, bones, muscles, everything. These are, I am giving you ideas. You are supposed to know laceration. What is laceration? Okay, now be attentive. So, 3 things: abrasion, contusion, laceration, and fracture. Medico-legally, from forensic medicine point of view, what is the definition? Please go and learn and come in the next class. ये कुछ ही रहेंगे. He is going to take classes next or next to next. So he is going to come and share with you. Okay. Laceration can be split, stretch, cut, or eversion. Now, what is the meaning of eversion? मतलब हिंदी में क्या बोलते हैं? फाड़ना. Okay. बिल्कुल something एकदम comes out. Jersey फाड़ना is known as eversion. Now, split laceration. Split laceration. अब इसको मैं ज़्यादा खींचूँ. दो वर्ड्स होते हैं. I am doing this too much. What is here? This type of thing is known as split laceration. What is splitting is stretch laceration. Okay. Splitting and stretching are very similar. Yet there are differences. If they are going to split, generally clean edge होता है ना. It will be steer. If we stretch, then the edges will be much more irregular. These are very practical based things. So highly attentive. Cut lacerations are actually the surgical rules. When we go for an operation, surgeons, when they give an incision to a when they incise, that is known as a cut laceration. Okay, understood? And eversion meaning suppose somebody has pulled someone's hair. Okay, one is laceration. With the hairs, if some of the other tissue part, the muscle mass, if it comes out, then it is known as eversion. Understood? Because of stretch laceration. Why? When you are trying to stretch something, rest of the tissues on the strands vary. Can you see connecting tissues there? These. Can you see these? So, if it is an incised wound, we clean the wound. We are doing it. How we do the surgical day, like over pain, okay? And how we give an incision. The way you draw, or the way we sketch or draw. We give a clean incision like this. So, when we are giving a clean incision, we are very clean through the throat. There will be no attachments. Okay? Suppose, for example, arterial wire, and against the wall, something has been stretched, which is desired. जब ऐसे होता है, then due to the shear force between the two surfaces of the two edges, कपड़ा ऐसे फट जाता है. तो जब ये फटेगा, there will be some of the other strands which will be intertwined in the remaining portion, and vice versa. समझ में आया? This is the reason we are finding such sort of lacerations. Understood? अभी laceration में समझ में आया ना सबको अन्य types. Now, due to sharp force, for example, I take a blade, incised wound, most best example of incised wound are surgical incisions. Okay, these are known as the incised wound. Chop wounds, we can see as the meat chop, butcher, good, is good. Stab, when you see stab wound, something which has a sharp pointed blade, we puncture something. That is known as a sharp stab. Stab में क्या होता है? With full force. Okay, this is known as the stab wound. And miscellaneous firearm defense and fabricated. What is the meaning of fabricated? Fabricated money. What is the meaning of fabricated? Fabricated meaning क्या समझना है इससे? I don't understand. Can we fake our bruises? Can we fake bruises and abrasions? Can we fake abrasions? Can we fake? आपको क्या लगता है? What do you think? What do you think? Don't look at her. Can she fake an abrasion? Why do you keep on why does everybody keeps on answering in English? They are not in English, they are in India. You guys, this is a recording of MBBS to your college. If you think, yeah, sometimes we can. So, fabricated wounds are those wounds which are actually not real. We have made them up. Now, this is a question. Repeat may be other as well as in case of consequences. Where, how can we understand this is a fabricated wound? It will be present in locations which are accessible to that individual body parts. Such locations which are accessible to that individual. Okay. It is highly unlikely I cannot reach certain parts of my back or my leg or my hands and other areas. Understood? They are produced with certain types of poisons. Okay. In these, due to the application of these poisons, you will have bruises, but there will be itching around those bruises. Or you will have lacerations, but there will be itching. As well as there will be swelling around those areas. Okay. Ideally, do you see around any bruise there is itching or swelling? Does it happen? It does not happen. Okay. If there is a bruise का मतलब है contusion. Cricket की ball का this is that is known as a bruise. See, this is a contusion. Okay, everybody. कभी ना कभी in your life you have gone through a bruise or contusion. Abrasion, it is very common. Okay. Laceration. See, in this laceration also there is some continuity of the tissue. Okay. This is more of an incised wound. This part, this portion is more of an incised wound. This part. See, it is clean and cut. Okay. There is no continuity of the tissue on the floor of the injury. There is no continuity of the tissue from either side. We are not finding any sort of hair follicle or hair strands here. Can you find any sort of hair follicle in hair strand? No. And fracture. Fracture, this is a open type of fracture. Why you can fracture? These are the ends of the bones. Okay, this is a type of open fracture. Examine the radiographs which you provided. You will be fracture level and what type of fracture you have. Close fracture. So, in this contusion, are you seeing any sort of swelling here? On these contusions, any sort of swelling here? दिख रहा है यहाँ से? No. For any people who may have normally when you are having a contusion, does it itch? No. So in case of it is fabricated, if it is fabricated, it occurs because of some of the other poisons are usually right. People do it, right? How do we differentiate it? If it is real or false, first it will be in places which are easily accessible for individual purpose. ठीक है? Random जगह पे नहीं होगा. Like a true contusion of bruise. Second, there will be some itching around the bruise, or there will be some sort of swelling around the bruise. Okay, swelling not like in generalized swelling, specific areas of swelling, like scales. Burn injury में कैसे होता है? कैसे? Understood? Okay. Fabricated के साथ difference. Now defense I have explained everybody, and firearm injuries. Firearm injuries is an entirely different chapter. You need to know firearms with pistol. Shotguns, machine guns, all of the types of guns are supposed to know their parts, their cartridges are supposed to know everything. The type of injury you need to identify. The type of bullet injury, just to identify करना है आपको किस लेवल से हुआ है, okay? As well as the type of bullet, you need to identify that as well. You will have classes, most probably. Okay, so now types of weapon में there is blunt, sharp, and firearm. Firearm weapons are present. Next, we talk about GC fracture. Okay. So, we have studied With joint. With a mid joint. U. What is this type of fracture? What type of fracture is this? Close fracture. Good. Close fracture. Close and what? Open and closed are opposite things. Something which is open, how can that be closed? एक तुम लोग की foramen magnum is it made is small and short. ये सब मत बोलो. ठीक है? Try and answer something original. You have seen that it is a closed. Is it a closed fracture? Here is a closed fracture. This, what sort of fracture is this? बताओ. Can you see it's the bleach? Huh? Then what sort of fracture is this? Open. And this one, see the gap. It is dislocated fracture. समझ में आया? See, fracture भी होगा और इस fracture का ulcerative होगा. These are fissure fractures. Injury, if it is done in the clinic, then we are supposed to go on these things. Okay, finally, दो ही चीजें आ रही. This fissure fracture in the skull, it is important. I will take a question after this. That this is a closed and dislocated fracture. Okay. This is a open and dislocated. This is also a dislocated fracture. Okay, because the anatomical position in which it is supposed to leave the body is completely क्या हुआ है? क्या हुआ है? anatomical position पे है कि नहीं है? नहीं. Next. What is this? 5 marks. आपको पता है? Consequence point of view से क्या है? What type of? See, in FMT or as doctors, you are not supposed to say आपके पास कोई injury आया है. You are not supposed to say this is a part injury. Okay, if there is skin bleach, whatever I have shown, then you are supposed to answer that it is laceration, okay, or abrasion, or contusion, or bruise, or it is a fracture. क्या चार चीजें बताएं? Let's repeat. First start with abrasion. क्यों? सीधे आपके पास रैंडमली होता है. Skin is continuous. Suppose these are किसी चीज से, okay. So just this superficial part will go. Okay. Then what does it form? Abrasion. After abrasion, if there is bleeding which is not come out in the surface, still the skin is continuous. And but yet there is bleeding which is not come out. क्या आप लोग इसको contusion or also known as but contusion or which is also known as bruise. Okay. Now the skin has completely separated. Okay. Open skin, bleeding is present. इसको हम क्या बोलेंगे? Laceration. And if there is some sort of bones in the bone fracture, understood? Now, so what is this? What is that? What is this? Laceration. Okay, this is a laceration. Now, okay, now we are starting with the difference. All of this we start with the done difference. Now, why I have mentioned the measuring tape area? You need to what do we need to use in consequence? When आपके पास कोई patient आया, you will examine the patient with an injury, which we will teach you in the 4th week of this month. Okay. After an injury reporting, suppose this is an MLC case, 10, 20 years later down the line or 1 to 2 years later, you will be summoned by a court to go and give up your opinion as an expert opinion to which type of injury it was. Is it possible that that injury has occurred from the corresponding weapon? For example, if I hit with this on Madhurima's head and there is a certain type of contusion which is found. Now, she has got a final complaint against me, don't worry. After that, when I will be, chalo, who is examining? She is examining. Okay, when she is taken to our IPD. Now, she will be summoned by the court after 2 to 3 years or whenever she is summoned. And she will be asked to describe the type of injury that she saw in Madhurima's head. And if that injury is possible from this corresponding thing, device, or whatever it is. Understood? Hence, knowing the type and nature of injury is very important, and knowing which object is done is also important. Okay? Some of the injuries. How do you describe an injury now? You are getting the pictures now. Take the pictures religiously with responsibility and certainty. Answer like this only in the exam. All of these points are important. Do not leave out anything. Suppose this is a cane. So, For example, if it's similar to this structure is long and cylindrical, this is also long and cylindrical. Everybody argue. Do you disagree that this is not long and cylindrical? Or is it long and cylindrical? So how do we first describe what is the type of the available use? Blunt or sharp. So this portion is sharp. If I move it, blunt or sharp. Blunt, first point done. Next, does it look cylindrical? It does look cylindrical. But if there is a specific shape, then try and mention the shape. Understand? Are you guys okay? Because समझ में आ रहा है? Everybody, you do always lost. पता नहीं क्या होगा लोग सारा टाइम दूसरी partition और नाम होगा इसकी partition. अच्छा. Hard or soft or hard. If I take this in comparison to this, is it hard or soft? Soft. Flexible? Yes. Flexible. Is this flexible? No. Okay. These are the points we're supposed to mention this. So this is hard, non-flexible. I cannot bend it, right? Non-flexible. Heavy or moderately heavy? If this is heavy, तो ये क्या है? Heavy, very heavy है, heavy good. क्योंकि very issue बहुत आप respectful रहेगी. Okay, so this is moderately heavy, right? तो ये next moderately heavy. Yeah. Next, when you are trying to describe it, say how many parts are present. For this, there is only one part. Okay. For the cane, how many parts are present? Two parts are there. There is a stick and there is a handle. Okay. Now we need to describe individually the handle and the stick. No. To key repeat. What are the key words? Repeat. Lost. This is a blunt object, cylindrical and then okay. So in case I will next time I will need to stand here. I don't let you even sit. I don't take it above power. Acha. It has two parts, right? There is the shaft. You know what is medium. Shaft is bone के लिए नहीं होता. Shaft means anything which is long as such. Okay. So which portion will be the shaft? This is the shaft. Okay. And there is a handle there. Understood? So first we need to describe the shaft. Take it long, cylindrical, non-flexible. And now next point क्या है? Okay. You need to also describe the material which it is made up of what? Iron. What will this be made up of? It can be plastic or it can be wood. वो आपको देखना है. Okay. So you need to see the material. Next is length. इसका what is the circumference? Measure it. See, can we measure the circumference when I am talking about length? This is the reason. I can measure it and measure the length. Okay. Understood? 31 centimeters or 32 centimeters. Okay. How much is the circumference? If I take from 0, then circumference is 4 centimeters. Understood? Everything so 5 centimeters. Like this, you measure the length and the circumference of that part. Next, what do you do? Describe the width. There are two ends present here. One end is attached to the handle, another end is free end. Understood? Next, go to the handle. I am telling one कि आपको खुद से ऐसे करो. समझ में आया? ऐसे बच्चे को आप बोल रहे हो, right? Next, in the handle, first check which type of handle is material क्या है, wood or metallic. Sometimes it can be of metallic. Metallic में क्या होता है? रोजमर्रा की लाइफ में sometimes there is something which is encrypted or encrypted. So if we hit with that part of someone and the encrypted portion is formed as a bruise on the head of the body part of other type on the next person, then you can identify the object which is the object or the vector at the scene of crime. समझ में आ रहा है? क्यों important है इसको coordinate करना? Next. Okay. If it is a rectangular object or here it is rectangular, sometimes it can be circular, it can be spherical, whatever the shape is, like the shape. Length, breadth and height are made. Okay. Now, this much done. Understood everything? How to describe so much there. Coming to the injuries now. What are the injuries? So, our mother, the cane, what are the injuries that are possible? Injuries क्या possible होगा? Contusion good. Is abrasion possible? What? How can we cause abrasion? Abrasion is a very common thing. Abrasion can be caused by this one as well. So it can produce abrasion. Abrasion is one of the most common things. Abrasion contusion there, laceration possible there. Yes, it is weak to hard surface के ऊपर sometimes there is pressure laceration also occurs. Due to extreme amount of pressure, the skin is going to split. It happens in case of both chronic injuries. Because of tires, tire mark भी है. Abrasion occurs as a tire mark ना, you can have pattern decoration as well. The pattern which is present in the tire, it will get imprinted in your body. So laceration is possible with it. Next, what fracture is it possible? What type of fracture will it be? Close and dislocated. Very good. Why dislocated? Joints weak. Basically, it is possible because of the amount of force. It is a heavy object, right? पूरा टूट के निकल भी सकता है, or else it can just be removed, or it can move from its original anatomical position. Good, nice. Now, MNC importance there. This is important. You can have simple injuries, you can have grievous injuries, homicidal injuries, and rare suicidal injuries. Do you know what is the meaning of homicidal charge? What is homicidal? Definition true. Common constraint. What is homicidal? Yourself. Homicidal. Suicide क्या होता है? हाँ, suicide क्या होगा? अगले बार. Exactly. Accident is accidental. By accident. Okay. So it's rarely suicidal. Why? Unless and until somebody is mentally challenged. Okay. Unless and until he goes on hitting this with this on his own head, he won't die. So rarely it's suicidal. Okay. Commonly it causes homicidal injuries. Accidental injuries is also present. Simple injuries to छोटा मोटा injury भी होता रहता है. What is grievous injury? Why have I mentioned this? It's really important because you have done now this one. Also chapter cover. First chapter laws and ethics. Grievous injury क्या होता है? Definition. कुछ नहीं हम लोग लगाए हैं. चलो grievous injury क्या होता है बताओ. Right. Grievous injury falls under which BNS? What are the different types of injuries? Teeth fracture of a tooth. Will it fall under grievous injury? Sure. Loss of hearing. Will it fall under grievous injury? Loss of eyesight. Disfigurement of the face. Grievous injury में आता है. If somebody got beaten in a mob attack, okay, and more than 21 days, that person is in the IPD, bedridden. Will it fall under grievous injury? Is a what under grievous injury? You are supposed to know. There are 8 or 9 clauses or subcategories. No brutal or grievous injury to जानते Suppose in case of injury reporting, you are given a case, okay, and it is mentioned in acid attacks. They fall under grievous injury. Some accident has happened between two friends. Okay, they were caught into fighting with each other. Nothing externally has occurred except for one. Friend A has done a tooth eruption of friend B because of the way he punched. One tooth has come out, or one tooth has been fractured. So, that's why it is not a grievous injury, but it falls under grievous injury. So, that person will be booked under which section of BAS? What punishment you are supposed to know? इसीलिए grievous injuries के कितने subsets and clauses हैं? Go and read all of these things. Understood why I am saying all of these things are important. चलो, it can cause grievous injury as well. If I hit with this to someone and the hearing capability goes away, then it will cause grievous injury. Okay, so grievous injury होगा. Next is manslaughter. Do you know what is manslaughter? No, boss. Come here. Come and stand here. I don't have time. There are so many weapons. You guys are reading that clueless or what? Some faculty is asking you to come and stand here. You are asking me. There is a limit of audacity that you guys can. It's surprising. Come and stand here. I am not going to beat you up. Now, This is a neck of someone. Okay. If I take this, and if I take this, okay. Just strangulate the person. Is it too much? If I strangulate the person, then the person will die. Okay. If I do too much, the person, the neck is going to break and that person is going to die. So if in case of a wrist, because somebody's neck, then this is specifically is known as mansola. Okay. I think mansola. Okay. It's known as mansola or carotid golden mansola. समझ में आया? This one and that one, you can do the same experiment. Okay, समझ में आया? Now, is it possible with pain? Is possible with pain? Iron don't take a sort of lathi stick, hockey stick. All of these are possible. Yeah. Next, iron pipe. Iron pipe. This is iron pipe. Going into see the description again, you can say description. Understood everybody? Okay. Now, the type of injuries produced, the abrasion member is an important graze abrasion. Graze abrasion का मतलब क्या है? If I rub this across my skin, this, then the type of abrasion which is produced is going to be graze abrasion. Commonly, RDA में होता है, और when these people can play across the field, यदि एक surface is showing more shape, ठीक है? Then we will have graze abrasion. If one surface, एक surface है, दूसरी surface एक दिख रहा है, then we are going to have graze abrasion. Okay. With this, graze abrasion is possible. Pattern abrasion is also possible. Why pattern abrasion? Can you see there are some serrations present here? Right? So we can have bruise or abrasion in the exact same manner. See, are there serrations present? Awesome. यहाँ पे this is a very sharp point. यहाँ pass it. We have to do this. Pass it around and see the type of wounds which are used. Okay, we can have laceration. We can have fracture. Okay, we can have dislocated fracture, open fracture with this, and MLC. MLC में क्या होगा? There are patterns or serrations present. So accordingly, the bruise which will be there. These are the pattern serrations. These. Because of the serrations we are having starting minor tiny cuts है ना यहाँ पे just why is present. Can you see the bruise which is present over there? Now you can see two lines, right? Why two lines? When we do mix up with such a structure, this portion it will become as a depression. It won't be a point of impact. Understood? The points of impact will be these two edges. Because of these patterns, we have already impact. We can find two lines. Understood? So, now see me. What sort of weapons can cause that injury? Medical college pain or body stick or normal stick is there. Except for that word, is it possible to add a word? No. Why not? Plain added word. Very good. It is a plain added word. It is possible. It is possible to be the wooden stick as well. Right? Okay. So, now, we shall be talking about diagnosis. If this specific specimen is given to you, okay, this specific paper is given to you, how will you describe it? Somebody describe it. Describe it. Long. Start. Long. Yeah. Long cylindrical. Is it sharp or? Blunt. Textural or non-textural? Non-textural. Lightweight or heavyweight? Lightweight. Not middle. Lightweight. Bruises. Lightweight. Okay. Next one. Next step about it. Dimensions. Okay. We need to measure the length. Okay. Next, we need to measure the circumference. Okay. 117 centimeters. Okay. Circumference कितना है इसका? 8 centimeters or 7.5 centimeters. Understood? Next term, how many ends are present? 2 ends. Okay. One end is blunt and shape circular. इसमें हम इसका diameter बता सकते हैं. Understood? Another end is sharp or pointed. Okay. and sharp vertical tapering end base and a tapering end. So it is extremely sharp. Can I do whatever injury होगा ना extremely sharp for aspiration is I can start some case. है ना? Understanding? It is not class में जो पढ़ा है productivity ज़्यादा है. इसलिए होता है कि ये establish right quantity. ऐसे ही बताना है. Okay. We can also do lots of things. Abrasion possible with this. Abrasion possible. Next, what is possible? Lacerations. Okay. And then, bruise possible है? Possible. Fracture possible? Possible. Possibly not possible with this. Moving up to one. Is fracture possible with this? You have told this before. Unlikely, but fracture is not once can happen. Contusions भी हो गए हैं. Okay. They are extremely good. With extreme amount of force, if I take with some of this fracture is possible. Now, the interesting part is there are nodes and internodes present. When you describe this, you are supposed to mention regarding the nodes and internodes. If instead of this, like this, something is provided to you, are there nodes and internodes present? No. Where? You say yes. No. Okay. Which is a node and which is a internode. This one has nodes and internodes. Okay. If I cut rest of the portion and I present to this part, this portion, is nodes and internodes present? Remain. So the type of bruise which is possible in this, what type of bruise is that? Okay. This one. Why there are two low borders, two will graph with this difference? Why there are two borders present in the bruise? Maybe this one. One will be because of this edge, another will be because of this edge. Understood? This is circular right number. When you are going to hit this with someone, it will fall now like this. There will be two borders in the skin. Okay? In which there will be two bruise markings. Okay? So injuries produce abrasion and also pattern depression. Why pattern depression? Idea unlikely, but instead of this backbone, if we are providing the backbone which has a very closely placed nodes, okay, then the abrasion and it is not taking some skin, so skin like on the back or on the thighs, which is a very sensitive. So abrasion can be pattern abrasion or pattern. जैसे एक घिसल जाएगा वैसे ही पड़ेगा. Okay, so we have bruise which is also pattern possible. Laceration and fracture is possible in strangulation and concept. So always be attentive. If they are asking strangulation is possible or not, yes, with all of these things strangulation will be possible. Unlikely, but it is possible. Next, type of the injury is the injury is involved. Next, copy state. Regarding these things, we need to know how to describe it. I am trying to focus on this part. See, if you say it is blunt, hard, not basic description, it's not good. Now, see a description. There are three parts. There is a handle, there is a grip. There is a handle. There is a potato, much smaller, larger, cylindrical, curved, take the river, properly measure it, describe the shape, describe the color. If any material covering is present, describe it. Okay. Regarding the handle part, I have mentioned that just now, so we have described. Also regarding the splice, describe that part as well. Okay. Take pictures moving on. After this, take picture. Okay. Now, the injuries produced. Injuries produced क्या क्या होगा? Abrasion, bleeding, laceration, or contusion, being said. Okay. Next, fracture reduced fracture is highly possible with this. This is used for what? Mock violence and beating. The guys which people do it. So when they do it, fracture is much more common than actually abrasion or bruise. Bruise is common and fracture is common with this. Manslaughter, when you do with it, you can actually do it. Okay. Medico-legal importance. What are the MNC importance here? Simple injuries, grievous injuries, homicidal, accidental, and rarely suicidal. What will be the most common type of injury produced by a autistic? Actually, grievous is correct. Homicidal, yes. Accidental, possible. Guys can think themselves also. Their friends, they can meet each other. Don't do this. So it is possible. Chalo. Next, okay. Look at this part. See, the grip handles flies and the head. Okay, which portion you will say? इसको note करो. And another thing is regarding the fracture, if you hit on the head, depressed or what type of fracture is possible? You know what is depressed skull fracture? If injury is completed, you are supposed to know. Depressed. What is the meaning of depression? What is the meaning of depression? What is the meaning of depression? Depression का मतलब क्या है? जोर से बोलो. Bulge out is known as depression. Bulge in like. Okay. So if there is an elevation near that part, it will go down, right? That portion is known as depression. So depressed fracture in the skull, what will it mean? Depressed fracture. One fragment of the skull, due to the hit or the blow, it has gone inside the parenchyma. Okay, that is known as depressed fracture. Also known as pond fracture. So why we call it a pond fracture? In the pond, pond में edges of the pond when you see जब हम गड्ढा खोदते हैं, is it like we take a chunk of the meat or the mass or anything out, or there is a continuity with the base of the pond and the surroundings? There is a continuity, right? Pond fracture happens in case of children's bones, in their skulls, because children's skulls are not formed until and unless very late age. Not formed मतलब क्या है? The sutures are not fused, so it goes inside, but it doesn't break like it will break in us. Understood? Yes, this is pond fracture. Next. Another is you describe this way. This way. You get that. You know this way. What the parts of the body. Full body. These are the parts of the body. If you want to stretch yourself, you can go outside and stretch. It's okay. Just don't sleep in my class. Okay? It's very frustrating. What are the parts of the body? Come here and sit. Everybody listen to Amra. He teaches this. Where edges are mentioned? There is handle and there is a blade. Where it is separated, handle and blade? मैं ऐसे ही बता रही हूँ. Good. Okay. Which is the shoulder? Point out the shoulder. Okay. In the blade, point out parts of the blade. If you see laterally, we are able to find a swell. What is the meaning of swelling? Yes. So there is a part present. In your part also it is present. So we will call it, what is it called? Swell. Everybody, can you see the swell part? Okay. There is a spine and there is a splice. Okay. The lower part of your back. Go and see your back. In the lower portion, where it comes and divides, and then it divides, right? The sharpness is present. That in the lower end is known as spine. Okay. Splice. Okay. Go and see. Understood? So there is a handle and there is blade. Note down the part. The connecting portion of the handle and blade is known as what? Anurag, bolo. Sorry, Anurag, bolo. The connecting portion between the handle and the blade is known as what? Shoulder. Okay. Okay. Now, can you see it? There is a clear elevation here, right? This is known as what? Bow. Okay. This portion is known as swell. Understood? Next, we have a spine and a splice. Okay. Done. When you describe it, you will again say it has got 2 to three parts. There is a shoulder, there is a handle, and there is a blade. Okay. First, if we start with the handle, क्या है? Cylindrical. You will describe the name. You will describe the circumference. Next, you will say if there is any coating material present or not. If there is serrations present, why am I saying coating material present in the name? If there is serrations present in the coating material, then the type of bruise or the abrasion will be serrated abrasion, patterned abrasion, or patterned bruise. है ना? That is the reason it is important. Otherwise, so there is no point. Okay. Next, when you come to the shoulder, describe the shoulder, describe its length, breadth, thickness. जो कि यहाँ की thickness होगा कि height होगा बेटा. In case of affected back, it will be thickness or height. You don't know. Okay. In case of if I am talking regarding the blade of this back, okay, there will be thickness or there will be height or there will be breadth. What are the dimensions? Thickness, height नहीं होगा, कितनी होगा height? Okay, से क्या है parts dimensions? Length है, breadth, ठीक है? Circumference blade में नहीं होगा, बेटा circumference blade में कैसे circumference? Okay, so you will describe these parts. Regarding the handle, mention that one end is circular and the other end is to be attached to the rest of the blade. Okay, and describe the shoulder as the portion which is connecting the handle with the blade. Understood? Types of injuries produced बताओ, एक ही साथ बताओ. Nothing new here. कौन सा? Abrasion, contusion, laceration, fracture. Fracture will be very common here. Dislocated fracture. Now, medico-legal क्या होगा? Simple injuries, crevice हुआ. If beside accident can be once over this. First, the recruiter, in a child we can do better में हो सकता है, but highly आता है. हाँ, with the handle we can do and not so common. Ask him will he use his back to go to the master or any other person. Yes, it is possible, but highly unlikely. Example बोलते हैं try and answer the more common things है ना वो भी बात. Okay. Next, okay now stone or slab. For example, if it is this stone, how you are supposed to measure it? With this one like मैं हाथ में कर दी this. Yes, length, okay. The breadth, okay, and the height. Understood? Material describe करना है. This will put what? अगर कोई pattern see there is an ingredient present here. Yeah. So you need to write if any surface can be imprint करनी है. How many surfaces present here? 6. Okay. Edges कितने हैं? चलो कितने हैं? 1, 2, 3, 4, 5, 6, 7 है. 8. Okay. Color white, red, brown. कौन सा कलर है? Describe करना है. Okay. Next क्या? Okay. Injuries, common injuries, abrasion, contusion, laceration. Okay. Rest of the things. Fracture will be possible. 5 का होगा इससे. Right. Okay. चलो. Next, injury of medico-legal injuries क्या है? Suicide हो सकता है क्या इससे? If you think I will tie 3 bricks together, surgeon पे रखूँगी, इसके बाद खुद दरोगे, for my head, I will kill myself. Division ना, विभाजन, ठीक है? Answer all of these things. What's the practice? So, okay, चलो. Next, okay, break. Did you guys understand? Break का क्या करना है? कैसे आंसर करना है? हाँ. First of all, say what is the shape of this? What's it round? Yes, square. It is square है. What are the rectangular? What's the word? Ball. Who is going to describe the ball? Yes, very good. The right person. Describe. Dara, describe. Now they will be. Flexible or non-flexible? It's flexible. Okay, I am not a orthopedic expert, so for me it is not flexible. Right, flexible or not flexible? Go जिसका opinion girls, whatever opinion you give your opinion very confidently. Next. It is soft or hard? Soft. Hard. Hard ये बिल्कुल कर. Then, okay, color dark. No pattern is present. If pattern, then describe the pattern. Okay. Regarding the method, what did you mention? In case of pattern, what did you mention? Extra point. Stitches are present. What color? इसका mention color. ठीक है. Now, dimension. What can we find out from this? Measure. First step, which dimension you will find out? Videos. Okay. What are the injuries that are possible? Keep the ball in the medium. Those not serious. Okay. Injuries possible? Then abrasion and contusion is possible. Laceration, guys, is laceration possible with the ball? Huh? No. You need over laceration. Definitely laceration is possible. You never know how our injury is going to turn out when you do this, etc. Right? Abrasion. But mentioning about contusion is one of the most obvious thing with the ball. Right? Everybody agreed, guys, you will know better. But lacerations are definitely possible. What is your guarantee here? You have thrown this at somebody. And the skin is not going to split. Huh? So laceration is possible. Fracture possible with this. Possible. Airtight fracture, which is a simple fracture. Compound fracture, both possible. See the type of abrasion, sorry, the type of contusion. Like this we have mentioned now, so there are two edges. It doesn't seem like with a big one. It doesn't seem like, but two edges का होगा ना, तो means क्या होगा? Look at this part. This skin is not affected. Look at this portion of the skin. So there is a point of contact on the highest point of contact, and then skin area depression होगा ना, उसके बाद the vein which is to form, जो when it is going to be hit, then we are having that. इसीलिए whatever type of abrasion, contusion is important. Understood? कैसा type of contusion होगा from a ball? Okay. What are the best injuries? Abrasion, laceration, you mentioned fracture, replace, fracture, you mentioned what are the fracture possible? Those type of fractures is possible. Is located if I hit with this at your radius, this joint, and you can give the amount of force. Possible, right? Possible. Okay. Do you know what is compound fracture? Compound fracture possible. Multiple movement bones is movement in segments of the same bone or multiple bones. Okay. Compound fracture is also possible. Okay. Anatomical injuries. So MLC importance of this weapon. What is the MLC importance? MLC importance means what are medico-legal, what are the type of injuries that are possible. Understood? Now, what is it? MLC importance of this weapon. Start with the simple, then excellent. Good. Since I can get this, then you need to flip with this at your own head. Okay. Okay. Now, if we study about growth, island growth or any other growth, okay. This, are there any serrations present with this one? No serrations present. Can we, what is a load? Can it what is a load? Rusty की तरह इसको use कर सकते हैं हम लोग? हाँ? Don't go literally, but at time of need, can we use it? Yes. Examination. Good. If the ligation mark of this material will it have any sort of selection or pattern? Yes, two-sided. Very good. होगा बेटा? सोचो. अगर इसी किया तो सेलेक्टेड होगा. Strangulation mark, selection मतलब markings. मिलेगा इससे? अगर इसमें इससे होगा तो this okay. So in case of the rope, is it possible? Selection mark. इससे क्या होगा? Injury, strangulation. Homicide में what is the type of homicide? Strangulation is possible. Okay. How will you measure this? So when you describe it, flexible or non-flexible? This one flexible. Okay. Now this is blunt or sharp? Blunt. Okay. Next point क्या था? Lightweight. Hard or soft? Soft. इसको हम soft में okay. Now next क्या होगा? Describe it. These are negative no right. Hard material का hard है. Material. This is a soft plate, but the material is hard. What is soft? You cannot just. It's not a pulp, right? Okay. Next, you will take the length. Okay. If possible, measuring this one circumference possible here. Barely 1 centimeter radius. Okay. If possible, then you will measure. It is plain or serrated. We will measure that as well. Okay. Then we will go for the type of injuries which is possible. Okay. Understood? What are the injuries? Abrasion होगा इससे.
Yes.
Bruise. What type of bruise? Pattern. Okay. Contusion possible with this. We see yes. Contusion is possible with this. Sorry, say it. Contusion is safe. Possible with contusion. How? Pressure bruises. Okay. Laceration possible with this one. How?
The smaller.
Now, you can describe it. This is one end. Okay. If a proper rope is given to you, it will be cylindrical in shape or round in shape or spherical to नहीं but round or cylindrical. See, this tip it is pointed. Suppose this one is only given as a ligation material. हो सकता है ना? Somebody has got an hand himself or herself. Okay. चलो, अगर ligation material को describe करने बोलोगे, then one end will be cylindrical, another end is pointed. If it is very sharp and pointed, it can. Okay. Lacerations highly unlikely. So try to not answer it. But if you are answering, then mention that laceration is possible, but unlikely. Okay. Understand? Fracture. Fracture to is fracture होगा इससे. Sure. Fracture of the small bones were definitely possible. And suppose with this rope only, it is tied with some trap or something, and आपका हाथ फंस जाए. Understand? Then fracture of the bone is possible, but unlikely. I am telling you all of the circumstantial things. Be right and give be practical and then answer to the exam. Okay. Now, MLC important, simple, greatest, homicidal, common, suicidal. Suicidal is very common. Homicidal में क्या होगा? Strangulations. Okay. Next. See. The ligation one. Can you see the pattern? This one. Can you see the pattern? अच्छा, मुझे बताओ. This is of what material the ligation one से है? Right? The impression is absent. Also, you can clearly see the buckle which is present, which the guys when they wear a belt, there are two edges, right? You put it through and through. The impression is very similar to that. ऐसे reduce करना है, समझ में आया? Belt can also be used as a ligation material. Okay, it's very commonly used as a ligation material. So here the impression, see, can you see the pattern impression which is present here? Also, another important thing is that ligature mark will be parchment like parchment is parchment paper. Very dry, rough, and brittle like a bone. Very dry and rough. You don't know what you look like. It's not coming. So, if I use it, instead of that, it is an egg. I use this. And I do this. With extreme amount of pressure, so much that the blood flow, it stops then and there. Okay, at that right moment. So, what will happen? A white band-like structure will be formed because of the extreme amount of pressure which is applied. Okay. In such cases, stand here. Such parchment-like appearance occurs. Can you see? This is red. What does it mean? The blood flow was present here. Can you see the portions which are white? What does they mean? Blood flow was absent. Why blood flow was absent? Because of the extreme amount of pressure which was applied. Even the microvasculation of flow, that was also stopped. Understood? What is parchment type? Okay. Now, give me your hand. Okay. So, if I use this as a ligation, so selection one will be present. See, in this one, can you see there are certain pages which are elevated and there are depressions present. The portions where elevation is there, those are the portions will usually come in contact with the skin and they will leave an impression. The portions which will not come in contact with the skin, they won't leave any impression. Hence, we find a pattern. Understood why is the selection? Now, underway, just right.
Long life.
Underway, not like surgery. Like surgery. You feel the wound, then how it will cut. You learn. Later. When the person is healed, can you see it's compared to this part of the skin? This is very white. These are known as parchment type wound. The ligation wound which I have shown you this. Can you see it's so white? It is very unlikely that in our skin we find something which is so white. These are known as parchment type structures. Okay. So, describe it. How many parts are present in this? How many parts are present? Only 2-3 portions are left. There are individuals. 2 parts are present. There is a handle and there is a big block. Okay? Handle properly you describe it. It is long, cylindrical. अगर कोई leather covering है, then it's hard. Okay? Non-flexible like this we describe. In the big proper, flexible. Measure the length, diameter, measure the circumference which is attached to the handle. One end is attached to the handle, another end is attached to what? Another end is attached to another end is free egg, okay, pointed free egg. So that describe all of the dimensions there, mention all of the injuries, mention the very critical importance of this injury. So now see, laceration होगा commonly straight, abrasions होगा, contusion होगा क्या होगा? Laceration. Everybody that you are seeing what is laceration. These are not lacerations. See, a wig or a rope, anything. It is not that much sharp. It doesn't have sharp end. But when you hit it, it's so much of force. Due to the pressure, the skin is going to get separated from each other at the point of impact, which is going to cause a laceration. Understood? Now this laceration could be split or it could be stretch laceration हो सकता है. These are the potential ones. Next is the the bicycle. If you describe it, it is what is this? Flexible. Flexible be not flexible. It is yes. It is flexible. It is flat, but it is flexible. It doesn't have any sharp tips. No sharp tips are present, so it will be flat. Flexible. It is definitely hard. It can be light or moderately light, and it is made up of individual segmental parts. Okay. What are these individual segmental parts? Can you see which are attached by ball bearings? Okay. Describe it like this. See the color, which color is present in non-dense liquid. Okay, description हो गया. Injuries you know, you can see what are the importances you know. See the injuries which can be possible. Amputation injury of the fingertips, abrasion injury of the finger of the toes, highly common. So, most common type of injury in the bicycle chain or metallic chain. What is the most common? Abrasion. Laceration. Abrasion is a type. What are these? Tendons. These are nerves. What? This is nervous. Primary nerves. They go. How does it occur? If it gets stuck, means the chain go. This is possible. Bruise, obviously bruises possible. Pattern bruise होगा इससे, okay? Abrasion is also possible. Laceration possible, and other sort of injuries, fracture is also possible. Regarding hammer, how do you describe it? This handle or the shaft in the middle. Describe the shaft. It will have a leg and what? Circumference. The metallic part, two ends are present. Okay, one is a pointed end, another is a blunt end, which is circular. It will be heavy, made of what metal? Any other finding imprint you see, then describe. Dimension में, in the dimension of the circular end का circumference बताना. Types of injury which is occurring. Types of injury what? Contusions. Abrasion possible? With the hammer, abrasion possible? Abrasion is possible with which part? Commonly? Shaft. Good. Bruise is possible with which part? Shaft. Acha. The type of bruise which is possible with the shaft of a hammer. What is that type of bruise? You know something as traumatic appearance and labor type appearance. If you have not studied these, then what you have studied in injury? The thing which I have shown, the lathi or the stick, that is known as traumatic appearance. Why traumatic appearance of the bruise? There are two lines which are present, right? And what is railway track appearance? Railway track dekha hai. There are lines, and then there are in between lines are also present, which is possible from a stick or a serrated thing to give a railway track appearance. Okay? Now, with a hammer, see, these are depressed fracture. This portion is gone inside, right? That is known as the depressed fracture. And this is the bone fracture, which happens. Can you see? There is a continuity of the skull is present, or you can see clear lines of discontinuity. On the image number C, in the image number C, answer me. Can you see any clear line of discontinuity in the whole skull bone except for the normal anatomical sutures? Okay, or you see just a depression with continuity with the rest of the bone. Which one have you chosen? Depression with a depression with क्या दिखाई दे रहा है? Continuity with the rest of the bone, which is a bone fracture. Okay. Okay. Laceration possible now. With hammer, abrasions and contusions are also possible. See, if I hit somebody with the sharp and pointed end, you see lacerations. See the images. What is this type of fracture? Which is this bone? Skull. The type of fracture which is you can see is known as fissure or linear fracture. Okay, understood? What is this? This fracture we have on what? Is it torn or it is depressed? Some sort of fractures are possible with a hammer, okay, with the blunt, with the shaft, as well as with the metallic part. Okay, you answer. Which bone? This one. Good. Which bone? So, I had mentioned a compound fracture. Who was the one who answered compound fracture? You. Right? Show me the compound fracture. Is this the best compound fracture? What do you answer? What is compound fracture? You was here. More than two parts of the bone. Can you see the compound fracture here? If there is more than two parts of the bones in a compound fracture, can we see any compound fracture in these pictures? Huh? No. India. Yes, there is compound fracture. What is this? This. How many parts? There is a breach here, there is a breach here. Understood? Look at everything. Okay. So, this is an open fracture. Is there any compound fracture here?
Yes.
Okay. So, this is an open fracture. These are possible